so Becca can get her presentation started. So really quickly.
All right. Can folks hear me and see my screen?
Yes, you're good.
Terrific. So let me just get everything oriented in front of me here, since it's not a stand-up presentation where I'm usually holding notes and walking around. But I already introduced myself. So what I want to do today is provide you a little bit of information on various environmental health issues, and particularly the link between toxic chemicals, mostly industrial chemicals that are used in our environment, that are found in our environment as contamination, or used in the everyday products that we use. I will mention that some of you have heard this. You already learned this in school and things like that, but we want to make sure everybody is starting from the same baseline. And so that's one of the things that you'll notice is that sometimes this will be a refresher for you, and other times there'll be new information. And hopefully there's enough new information for everybody. So if today is more of a refresher, you take that in. We will make the slides available in PDF form and send those out to you. Mara is probably going to talk about some of the other logistics, like the web page that we have, and things like that. Oops. So we have a couple of learning objectives today. Again, sort of basic things that we want you to learning about, actually I should have changed that slide, 4 different routes of human exposure to toxic chemicals in our homes and in the environment, and list at least 3 different health problems that have been linked to exposure to toxic chemicals in products in our home and in the environment. We're going to talk a little bit about what the problem is here. So discuss why we have toxic contamination in many of the things that we use every day, in the drinking water we have, our air, and in our homes. We'll talk, as I mentioned, with the learning objectives about a couple of different routes of exposure, dive in more on what makes populations vulnerable, thinking about what other considerations we should consider as health professionals related to what makes people more susceptible to disease related to exposure to toxic chemicals, some information about bio monitoring, pollution in people as a lay term, or things like that. We'll go through this acronym CHOPS to learn a little bit more about what you should consider in terms of where people might be getting exposed to environmental hazards. And then finally, talk a little bit about, remind ourselves about why we're so toxic, and then what can we do. So I'm going to bring you down in some of these parts of this conversation, because there are a lot of different exposures to consider, to think about. But what I hope to be able to do is empower you at the end of the presentation to see some opportunities where you might be thinking about making change or adding those into your repertoire of things you're doing in your community. So one of the things that we like to talk about is the fact that we have a really toxic problem in the United States. A growing body of scientific information is showing that toxic chemicals are found in many of the things that we have in our homes and that we use every day. Everything from drinking water that can be contaminated with lead, as we learned from the Flint water crisis, or PFAS chemicals, as we'll talk more about today, and the crisis that we see in many different communities around the state. Flame retardants that may be found in our homes, like our furniture, our bedding, and some of the electronics that we use every day that are linked to negative health effects. The very food that we eat that can be contaminated with these industrial chemicals, as we'll learn more about, or things like pesticides and stuff like that. To cleaning products or personal care products like our beauty care products or shampoos and conditioners that can contain toxic chemicals as well. So we're exposed in many different ways, or in several different ways, to toxic chemicals in the environment. One of those, of course, is through our lungs and inhalation of both toxic chemicals or particulate matter or other things in the environment because of air pollution, but also some of the chemicals that come off into our dust in the environment can actually be inhaled within the home environment. What we know is that the inside home environment in some places can actually be quite hazardous to health when you don't have the airflow. And so this is, one thing to consider. Obviously, there's ingestion via our drinking water or our food system or hand to mouth activity. We'll talk a little bit about lead poisoning today. And so, hand to mouth activity that children have very naturally in exploring their world and then leading to contamination. Our skin is another place where it's important to consider that not all chemicals, stay outside of our body and must be inhaled or ingested. That some actually can be absorbed through the skin and affect us that way. So that's something important for us to think about in terms of exposure. And then, particularly with this group, we like to highlight the fact that you actually can have intravenous exposure as well. And that might be through the actual plastic bags. We have worked with Healthcare Without Harm and others, and we'll talk a little bit about this at the end to make sure that the IV bags, particularly in neonatal intensive care units and NICUs and so on, don't contain toxic chemicals like DEHP, which is a phthalate that's linked to hormone disruption or endocrine system disruption and can harm particularly those vulnerable babies, but not good for all of us as adults either. So those are a couple of different routes of exposure. There are a number of different things that we need to consider when thinking about someone being exposed to a toxic chemical and the impact it might have on them. One of those is chemicals act differently. So as you can see in the accumulation or bioaccumulation slide or picture here, we have mercury, which is something that is found in many of the inland lakes, in places, in rivers and streams, in places like Michigan, that builds up in the food chain. That's present because of its use primarily in coal-fired power plants, or it's not use, but it's as a contaminant that comes from the burning of coal from coal-fired power plants, settles into the sediment of lakes and rivers, and builds up in the food chain, with ourselves being at the top of the food chain as we consume, fish, or in this case, in this picture, fish that are contaminated. The same thing happens with a number of different other toxic chemicals that may accumulate. This is something that we're also worried about and looking into in terms of PFAS chemicals. So those are per or polyfluoroalkyl substances, and I'm going to mention those a lot today. And the fact that we have a number of different fish advisories across the state of Michigan related to consumption of fish due to PFAS chemicals. In my neck of the woods, in the Huron River, we have a do not eat the fish advisory for PFAS, one specific chemical, PFOS, related. So you can't eat any fish out of the Huron River right now because of the high levels of contamination. Another thing to consider is the timing of exposure. And I'll go a little bit more into this in a moment when we talk about some of the more vulnerable populations. But when you think about exposure that can happen to children or in utero or infants, can have a much larger effect than it might have on us as adults. And so again, like I said, I'm going to go into the vulnerable population side in just a moment. Synergistic effects or cumulative impacts of exposure to environmental hazards is another piece that we want to make sure we're considering here. We're not exposed to really any one thing at one time. Let's say, for example, you live in an older home and you have a toddler, and perhaps you have lead that's in the windowsills, the window wells, because your home was built before 1978. And so your toddler might be exposed to lead dust in that case. At the same time, your drinking water may be contaminated with PFAS because you live in a community in the state of Michigan where you have that contamination. So that's a cumulative thing to think about, like, and a number of different exposures happening at the same time. There are a lot of question marks in terms of with toxic chemicals, what are the effects when you put them together? On the other side of things, one example is it may not always be two different chemicals that are having an issue, um, that are having a reaction together, or synergistic effect, but it may actually be exposure to one chemical and then something else. So, for example, when you look at exposure to bisphenol A or BPA, as many folks might have read about before, and then high levels of stress and cortisol in the body because of that, you actually see it has a more bigger impact of the BPA, of the endocrine disrupting factors of BPA. And in studies on mice in particular, for example, they have put mice in a stressful environment, expose them to bisphenol A, and they've seen that they are more likely to develop breast cancer like tumors as a result of this. So thinking about what are the other factors that it's not just exposure to a chemical, but it's other things that are an issue. I could give many other examples: lead poisoning and not having an adequate diet that in terms of nutrition with calcium, or um, uh, different vitamins to make sure that the body won't absorb additional lead and things like that. So, sort of the list goes on and on here, and we can talk about some of those things. Individual susceptibility is something that I'm sure all of you know, that some folks are just more likely to have something in their environments affect them, and then maybe their neighbor would. So they may have the same exposure, but it may be, again, if we think about perhaps a stressful environment, poverty, things along those lines that lead to outside factors that make someone more susceptible. And then there's those X factors that we can't really put our finger on why someone gets cancer because they're exposed to high levels of a particular chemical and their neighbor does not, even though they have the same chemical in their drinking water, for example. I want to talk a little bit about doses. We used to think in public health that the dose makes the poison. And so that, the higher doses that you might have of a particular toxic chemicals, the more of an impact it's going to have on the body. But we're learning from studies related to hormone disrupting or endocrine disrupting chemicals in particular, is that there isn't that linear relationship necessarily with a higher dose, meaning that something is going to have a higher impact. So I put up a couple of these dose response curves. So this may be something, if you've studied public health, you've seen before, in terms of, again, the first one on top is the dose makes the poison. The higher level of exposure that you're going to have to a particular hazard, the more of an impact it's going to have, the more likely that you might have a negative health effect as a result. The non-monotonic curves that are below that you can see here show how exposure to endocrine disrupting chemicals in particular have different types of effects in the body. So some at very low levels, as you can see, may have almost no impact or a very high impact depending on the particular chemical. As we know, hormones that are acting in our bodies at really low levels. And so to be able to sort of open our minds and our thoughts to the fact that you may have a different response to a particular chemical or something like that than at other levels, and not just always being a higher level, that's the most concern. So I mentioned I wanted to talk a little bit more about vulnerable populations. And the ones that I'm going to focus on today are children and babies in the developing fetus, pregnant women, workers, and then folks that live in hotspot communities. So communities that live close to other polluting industries, or maybe roadways or something like that. So first of all, before a baby is even born, there's critical developmental windows that happen in, as you probably know, in organs and tissues and systems, including a very rapidly growing brain, reproductive and endocrine system, um, circulatory system, and things like that. So even at a certain day in a fetal development window, you may have an impact on a child that you might not have on a different day. So thinking again, if we go back to the other slide about the timing of a particular exposure and how important that is, to whether or not there may be a health effect down the road. Um, I'm sorry, let me see if I can go back. Um, so another thing that has been found, that over 99% of pregnant women in a University of California San Francisco study found that they carry multiple chemicals in their body that are actually passed on to their fetus, including pesticides, phenols like bisphenol, flame retardants, phthalates. Many of these are endocrine disrupting, hormone disrupting chemicals. Um, for example, phthalates are anti-androgenic and it can interfere with male genital development. And so exposure in utero to phthalate chemicals has been linked to shorter anal genital distance in baby boys. Similar things have been shown with chemicals like PFAS, per and polyfluoroalkyl substances, flame retardants, for example, like polychlorinated biphenyls. Sorry, that's the wrong flame retardant. That is a flame retardant. Um, polybrominated diphenyl ethers, PBDEs, that are found in that are found in our environment. There's a scientist over at Grand Valley State, Rick Grodziski, that found these in every fish that he pulled out of inland rivers and lakes in the state of Michigan a few years ago. These have been linked to low birth weight in babies, and also neurotoxicity in children from in utero exposure, and then other childhood exposure. So I could go on. Children, again, are extremely vulnerable, even out of utero exposure. So we think about lead, for example, is a good example. So children explore their world by putting everything, toddlers especially, by putting everything in their mouth. That hand to mouth behavior is natural and it's healthy and it's how they learn. However, when we have things like lead dust or flame retardants that are often found in dust or things like that, the child may be ingesting those chemicals in that way. So that's one of the particular ways that children are exposed. They also live closer to the floor. I'm going to go into biomonitoring in a second, but that can increase their exposure to toxic chemicals, because many of these chemicals settle in dust and again settle on the floor if you're crawling around or living near the floor. But whereas we aren't, as much as adults, you may have exposure that way. And I think I think transitioning a little bit to the fact that we want to talk about workers. So, and we'll get into this in a few slides down when we talk about where people might be exposed. But workers in different occupations may have higher levels of exposure to different toxicants. For example, they may bring those home, or they may actually be made more vulnerable themselves. Lead is an example. Again here. So many different folks that work either in industries that may have some contact with lead, or in construction, home remodeling, or things along those lines, they may actually have higher levels of exposure to lead. A good piece of news is that Michigan, 2 years ago, I believe, recently updated their exposure level, hazard levels through MIOSHA, to lower those, where they actually would bring workers home to reduce their exposures, so they wouldn't be on the line and again, or in the workplace again, until their exposures came down. So that number was brought down to be a safer level. There's more work to be done. The folks in occupational health at Michigan State University have been doing research recently in the last couple of years on take-home exposure. So adults may be working in an environment and taking home lead dust or things like that on their clothes and their cars and things along those lines. So in the work that they've been doing is both educating workers that may be exposed to lead on what are the best practices to not bring that lead home to your children. So taking off your clothes or things like that before you get into the home, going straight to the shower instead before you hug and kiss your kids, making sure you take off your shoes and things along those lines. And then the other thing I mentioned is that the hotspot communities, again, this is the fact that many communities, particularly people who are communities of color, communities with lower socioeconomic resources, face a disproportionate burden from polluting industries. We know this in Michigan. We know that there are some zip codes that are particularly vulnerable and impacted by polluting industries, by, you know, proximity to heavily trafficked highways and roadways and things like that. So there's additional air pollution and so on. To add insult to injury, often these places may not always have access to healthy and nutritious food that may be more difficult to come by. And these factors create the higher burden of pollution, but also a higher susceptibility because of these additional stressors. So one of the things that we have advocated for and continue to work on is additional biomonitoring of people to really get a sense at the population level, as much as we can, how what pollutants are found in our bodies, and then making sure we're doing medical monitoring to find out if those are having impacts. This is something that's going to come up particularly in present day as we talk about PFAS contamination and how important it is to both find out what, for people who live in highly impacted communities, what their levels of PFAS are in their bodies, and then what health effects may be associated with that, so their physicians can be made aware of things to look out for. So, for example, one of the PFAS impacted community members that you're likely to meet throughout this fellowship is Sandy Winstelt, who is a resident of Belmont, Michigan. And she has some of the highest levels of PFAS in her body. And we know that PFAS chemicals have an impact on the thyroid from various human studies, or not human studies, human research on contaminated community members, and then animal studies as well. So I think it was just a few months ago, Sandy actually had a diagnosis of thyroid cancer and had her thyroid removed. This doesn't necessarily point to causality, but it is one of those things that we want to make sure we're tracking, that we're paying attention to as a society, as a state, when we have many different communities that have very high levels of particular chemicals, in this case PFAS, in their drinking water, so that we know what to look out for, and that we're educating our peers that are health professionals about these issues in their communities. So toxic chemicals beyond PFAS have been found. You can see in the picture here many different ones that have been found in breast milk, pregnant women, newborn cord blood, health professionals. There was a study recently, not that recently anymore, of health professionals that included a few from Michigan, where chemicals like those flame retardants that I mentioned, PBDEs, were found, triclosan, so antimicrobial products, heavy metals and things like that were actually found in the health professionals, including a few Michiganders in their bodies, in their blood. So I want to focus now on where we might encounter, or where the folks that we work with might encounter, these different exposures in our environment. And a handy acronym to remind us of where we might find various environmental exposure is CHOPS. So again, the community, home, hobbies, occupational, personal, and socioeconomic. So when we think about community exposures, it's some of the things that we've already talked about, right? Do you live next to a polluting industry? So you can see there in the one of the top pictures, you have a child that's living right across the river from a factory. There may be air pollution and other things that are coming out of those smokestacks that are, um, you know, that are deposited on the play area that the child is playing or in the river, in the fish, for example. Folks who may live next to other things like landfills or other hazardous waste incinerators, things along those lines, agriculture, and even roadways that may have a lot of different contamination on them. In the middle, we put this up there related to public parks because there is concern about some pesticide exposure, particularly in very manicured public park landscapes. And one of the things that I'm going to talk about at the end on the solution side is actually what can be done at different city levels to improve the health of communities. When maybe we can't move something in Lansing or at the federal level, what can we do in our own communities with our local governments? So after C comes home and hobbies. And we'll dig into a few things here in the interest of time. I mean, I really could go through every room in this house and talk about little pieces, but in the interest of time, we'll just talk about a few. So I've already mentioned a couple of times lead exposure, and that is something that we're going to be talking about a lot in the next month or so, leading up to an advocacy opportunity with the Michigan Alliance for Lead Safe Homes and their Lead Education Day, where we actually will have a state to talk about different public policies that we would like to see them forward to protect children from lead. I talked a little bit about the exposure to lead through hand to mouth activity already in some of the other slides, so I think I'm going to move on from there. Other things, again, thinking about the contamination that in Michigan is problematic from lead. When we think about high levels that certainly were found in the city of Flint, there are a number of other areas in the state of Michigan that have been areas of exceedance under the new lead and copper rule, which is one of the strongest in the country that Michigan passed after the Flint water crisis, and actually lead in school drinking water is a problem, particularly now that many schools have water lying dormant in their systems. And we'll talk a bit more throughout this program about policy proposals related to the Filter First campaign in that. For arsenic, that's naturally occurring contaminant in many different wells and well water across the state, and something that homeowners have tested when they are purchasing a home. For PFAS, we know this is a problem, and these are a few of the cities that are mentioned here. Over 2 million people in the state of Michigan are likely to have PFAS contaminated drinking water. So you have contamination in Oscoda, which is up near the thumb of Michigan from the Worth Smith Air Force Base, Rockford, Michigan, from the Rockford and Belmont, Michigan, excuse me, from the Wolverine Worldwide contamination, either their dump site or their production using PFAS into waterproof shoes, and so on and so forth. Traverse City, I want to mention briefly because this is one that's we just learned about. There are a number of homes that have drinking water wells in the Pine Grove community area of Traverse City. And unfortunately, the contamination was recently detected from PFAS being used as firefighting foam in the airport there. However, the residents who live in those homes did notification from the state for over 8 months that they may have had contaminated drinking water wells. So this is something that we're working with impacted community members across the state and other environmental organizations to raise awareness about, and know that we need to do something, that families shouldn't have to be potentially exposed for 8 months to a PFAS or other contaminant in their drinking water before finding out more about this. It reminds us of what happened in Flint and what happened when many folks were drinking lead contaminated water there for a very long time before the state actually did anything. And then the last one, there is 1,4-dioxane. There is a plume in Ann Arbor, Michigan from an old industrial usage. Whew. So I want to talk a little bit about what PFAS are, and then we'll go back to other things that might be in our home. Again, these are the chemicals that are found in our drinking water, like per and polyfluoroalkyl substances. I have a map later on where you can see many of the different places where contamination has been found in the state of Michigan. We break these broadly up into long chain and short chain PFAS chemicals. And then there are other sort of differentiation beyond that. But the long chain ones like PFOA and PFOS are chemicals that we know more about. There's been quite a bit of study on this in the scientific literature, more health studies related to these chemicals and things like that. Those chemicals have largely been removed from use voluntarily by business in the United States. So it's still something that can enter through international market. The international marketplace, they're not illegal to use, but industry has largely moved away from those too. However, at the same time, we're in this problem of playing a toxic whack-a-mole with different chemicals then coming into usage. So, for example, short chain chemicals are those that have a shorter number of those carbon fluorine bonds. That's really what actually makes these chemicals, this class of chemicals, so strong, and why they don't break down in the environment. Is they have these really strong bonds between the carbon atoms and the fluorine atoms that don't break down naturally in the environment with exposure to sunlight or things like that. So they stick around forever, and they've inherited the moniker of forever chemicals as a result of this. These shorter chain chemicals are ones that are a little bit more slippery, if you will. So they move through groundwater and the environment a little bit more quickly than some of the long chain ones. And that is problematic in that we're seeing that they may have similar health impacts, but they also are harder to filter out with water filtration systems and things like that. So this slide is out of date. These numbers always go up. So there are over 5,000, I think it's closer to 8,000 now, PFAS chemicals that are known, substances that are known, and over 3,000 that are used in commercial use in the world. So why are there so many, and why are these chemicals in particular so ubiquitous? The problem is they're really useful. We use them in nonstick coatings like our Teflon pans, grease and oil resistant coatings. So you've got a picture right there of, a McDonald's French fry container, and using those on food contact materials to keep oil and water from absorbing into the packaging itself and leaking out. Water repellent and stain repellent coatings. You probably, if you followed PFAS at all, learned a little bit about the contamination, for example, in Oscoda, Michigan, and other places, and the Traverse City contamination that I just mentioned, related to the use of PFAS-containing firefighting foams, or aqueous film forming foams, foams that have been used to put out sort of petroleum-based fires. I'm going to talk later in some of the movement we've had in Michigan, but this is still a big problem. Everything from the list goes on and on here. You can see your Scotch guards that are aftermarket treatments for stain and water repellents in that way. So they're used in many different things, and they're super useful. However, they're also, like I said, they have different health impacts, and they stick around forever. So here are some of the health risks associated with PFAS chemicals. The one I want to focus on today is the suppressed immune response. And this is something that's particularly concerning given the COVID-19 crisis. We also know from newer emerging studies that there is a problem with vaccine efficacy if you have very high levels of PFAS in your body. So the vaccines that are critical for us coming out of the COVID-19 crisis may not have the same efficacy level for folks that have a lot of PFAS in their drinking water, and then as a result in their bodies. And so this is something that we're looking into, we're concerned about. More is coming out every day, and we're happy to share more information, all of these with you. Um, a number of different studies have really focused on some of these others. I mentioned thyroid disease already, elevated cholesterol. So some of those are actually comorbidities, are problematic with COVID-19. So again, folks that have elevated cholesterol or cardiovascular disease, perhaps because of contamination or higher risk of that because of living in a PFAS contaminated community, may also have a higher risk of morbidity and mortality, as you all know, due to COVID-19. So we'll talk more about this in a presentation on PFAS later in this program, but there are a number of ways that actually PFAS can enter the environment. We already talked about firefighting foam and runoff from that. Sewage sludge is something that is a problem because PFAS is in our water systems in so many places in the state. We actually use sewage sludge quite a bit in the state of Michigan, to put on our agricultural fields, and there's a problem with that because PFAS can actually enter the food chain that way, enter into plants, and then enter into any animals and build up as a result of that. So we'll talk more about that in the PFAS specific presentation. So I won't focus too much on brominated flame retardants. I mentioned the one class of those, polybrominated diphenyl ethers, and chlorinated flame retardants, which are their cousin. But these are things that are found, again, going back to our shops, in our home, like many of the couches that we sit on, or our electronics, or things along those lines. So the next letter in our acronym is occupation. There has been, let me make sure this is showing up. Okay. There has been, or have been a number of studies that have shown that people who work in certain occupations that are exposed to higher levels of radiation, like people who work as pilots or in other flight attendants and things like that, have higher levels of radiation exposure. Obviously, in certain industries, shift work can also be an issue to consider in terms of making it harder for someone to sleep and things along those lines that have been linked to higher levels and risks of diseases like breast cancer, for example. Well, something has happened with my slides. So I'm gonna stop sharing for just a moment until I figure this out. Great, thank you. I think I have it working again. Not sure what happened there. Can folks see the firefighters and cancer slide?
Yes.
Great. So back to occupation. Our firefighters and other folks that are frontline workers obviously have a certain higher level of exposure to toxic chemicals. Firefighters in particular have a much higher cancer risk than the rest of us do. So you can see a National Institute for Occupational Safety and Health did a study on firefighter cancer, and you can see various types of cancer on that slide, and the increased risk factors that firefighters have. a lot of this happens due to combustion of many of the things in our homes, that may have toxic chemicals and nasty things to start with, but when you add fire into the equation, and that combustion can become even more hazardous and more toxic. So this is one of the reasons why we like to work with firefighters on things like moving out of toxic flame retardants or moving to safer firefighting foam, so they have less uh, contact and hazardous exposure to these toxic chemicals. Oh, good. I was so worried it was going to zoom back out to the whole planet. Um, just in the interest of time, I'm going to go a little bit more quickly here. We did talk about the fact that breast cancer on the shift work side of things related to is an issue. There's a Brophy and Keith study from a few years ago, particularly relevant to those of us in Michigan, that auto workers, particularly those creating auto parts, may have higher levels of breast cancer due to exposure to certain types of plastics and flame retardants, and also those folks who work in the canning industry related to exposure to BPA and other bisphenols in particular. So, something that's relevant to some of you is exposures that happen in the hospital. This is a older report at this point. Actually, this is one I mentioned before, exposures in healthcare workers. We participated in and had a few healthcare care workers participate in this. They tested positive for over 24 chemicals. You can see the list there. I mentioned some of these before. The reason that this is an issue in particular, and again, higher levels in the bodies of healthcare workers, is that if you're working in a hospital setting, you may have higher levels of exposure to certain types of phthalates. For example, if you're handling IV bags that contain phthalates that are used to soften the vinyl plastic. If you're still using different disinfecting products that contain your triclosans and your triclocarbans and disinfectants like that that can build up in our bodies and be hazardous that way. Woo. Um, so one of the things that in this CHOPS acronym that is important to think about is our lifestyle or personal choices that everyone makes. So that may be, prescription or illicit drug use, alcohol, smoking, and then what are you actually eating, and your diet and exercise and things like that. I will mention that this is not the focus in particular of this fellowship. We really will focus on some of the other aspects and the things that we need to make changes to affect, impact our industrial production of the things that we use every day to make sure that we're cleaning up contamination and things like that. Sometimes in health healthcare and in public health, we can focus very much on the personal side of things, and it's incredibly important. And it's important also to make sure that we're focused on those other pieces of this acronym and how people might have exposures because of the things in their environment and around them. And then finally, are the socioeconomic factors. And if you think back to one of the first slides we had, we talked a little bit about the fact that if you live in a particular area, you may be co-located next to a polluting industry. We talked a little bit about the impacts of things like stress in the body and higher levels of cortisol and how that can have a higher impact on creating breast cancer cells, for example, because of exposure to bisphenols like bisphenol A. But poverty and other social economic factors are incredibly stressful, and something that we really need to make sure that we're thinking about, because this can make someone more vulnerable to all of those other exposures they may have if they don't have, and if they don't have adequate shelter, if they're living, their life is stressful because there's a lot of environment. You may have heard of adverse childhood exposures or experiences, and this fits in there too. That the children who have more stresses in their early life are more susceptible to different diseases later on in life. And this is a concept that we're learning more about adverse childhood events, excuse me. I think I said that wrong the first time. We're learning more and more about, and something that we want to make sure we're considering there. The body remembers these, so to speak, these adverse events. And so it's something to consider when someone presents with a particular disease later on. So I told you I was going to bring way down. There's a lot of exposures, a lot of nasty things in our homes and our environment that the people you work with are coming into contact with. But there are things that you can do, and that is our hope with this fellowship program, is to give you, again, that toolkit to be able to make change. So one of the things, I think I can forward these and zoom in, is the work that's happening within the healthcare sector itself. So if you are a clinician or a health professional that works in a healthcare system in a hospital, there are ways to work with organizations like Healthcare Without Harm, the Healthy Hospitals Initiative, Practice Green Health, to create a green team where you actually can make change in your institution to make the impact of that giant healthcare institution smaller in terms of its environmental impact, to make everything better for your fellow workers and the patients that you serve. So we're not going to dig into this too much today, but we'll have more information available to you on what can be done. And we have others that work with us, like Tracy Easthope, who works very closely with Healthcare Without Harm and Practice Green Health. So if there are specific questions that come up through the program related to what could you do in your healthcare system if you're embedded in one, please do let us know. Another piece of work that's really important to the Ecology Center is moving the marketplace. We have a project called Healthy Stuff Labs, where we test consumer products and other environmental media for toxic chemicals. On the consumer product side, we work with a number of different national coalitions and campaigns to move manufacturers, retailers, and others to swap in safer chemicals and safer processes to protect our health, and to be able to use consumer power to move businesses in the right direction. This is really helpful because sometimes it takes moving the marketplace to move the wheels in Congress, that you actually need a number of industry leaders to take the first steps in order to again get some traction in the halls of Congress, to slam the door on the laggards, or at the state level to make sure that there are alternatives available and that businesses are using them. So here's a couple of different pictures of things. Whole Foods, for example, is a company that has in recent years moved out of PFAS chemicals in their food serviceware, their food contact materials. And so they made that pledge and they're working on that. Other main retailers, excuse me, that have done the same are companies like McDonald's has pledged to move out of PFAS in their food contact material. We work with Mind the Store campaign. So you see the picture there of the little kid in the shopping cart, and the Mind the Store campaign to release a retailer report card each year to rate different companies on what they're doing to protect people. I think I'll move from there, and there are other examples, obviously, related to moving Home Depot, Lowe's, and others to take phthalates out of vinyl flooring that's available for folks, so you have safer options on the store shelves that way. But one of the places where we're going to spend a lot of time, and what our next presentation is on the 15th, is really focused on what are the things that we can do in the public policy realm to protect our health and to protect people. So the Ecology Center works at a number of different levels, the local, the state, and the national levels, to change our laws and our policies related to the chemicals that are in our environment and the stuff that we use every day. So if we focus first on the local level, I mentioned there are a number of different policies that are happening right now related to sustainable purchasing or environmentally preferable purchasing. And I have worked with fellows before in this program to help create and shepherd through a process that culminated in 2019 with the city of Ann Arbor, Michigan, working on an environmentally preferable purchasing policy that has really strong language on toxic chemicals in the products that the city purchases. And if you think about it, cities have a huge economic impact. They buy a lot of stuff, everything from office furniture to building products to build new buildings to food contact material to use at the local ice rink or something like that. So this is a policy now that is being emulated in other places, and we're currently working with the cities of Detroit, Lansing, and Ferndale in the state of Michigan to forward new sustainable purchasing policies, as well as others across the country like Anchorage, Anchorage, Alaska, Providence, Rhode Island, and so on. So those are a few local examples. So one of the things that we're really going to focus on in the next couple of weeks is lead poisoning. This is a map of data from 2019 that's collected by the Michigan Department of Health and Human Services on children that have been tested for lead in their blood. So you can see in the dots there in the map that this is a problem that's happening all over the state of Michigan in various, this is a zip code level map. So not in every zip code, of course, but certainly in every county you have cases where children have elevated blood lead levels. We show this to lawmakers to make sure that there isn't the misperception that this is just an issue in Flint or in Detroit or things like that. And if you zoom in, you certainly can see that there are more cases in urban areas, but it is an issue still in rural areas across the state. A few years ago, Lenawee County was one of in Southeast Michigan down there which is a sort of suburban semi-rural area, was one of the areas that had some of the highest rates of lead poisoning per capita. So that's one of the problems that we see. And an issue that I want to mention is that because of COVID-19, our testing rates of children have really plummeted over the last year. And so that's one of the things that, as someone who serves on the lead commission and as someone who talks with people in the Department of Health and Human Services that work on lead exposure, that we're very focused on, and how do we encourage families to continue to, now that things are opening up again, to make sure that they take their children to their well child visits? How do we make sure our WIC clinics can get testing up and running? Because a lot of those clinics in Michigan actually do lead testing, which isn't the case in every state. To make sure that we can address this problem and we're not letting kids fall through the cracks. But testing is just one piece of it. And it's really a secondary prevention, testing of children, I should say, strategy. And it's very important. However, one of the things that we're focusing on in the State Lead Commission, and we would like to focus our policy efforts on as well, is making sure that we're working on primary prevention. So protecting children from lead exposure, lead hazards before they actually have an elevated blood lead level. So one of the policies that we are promoting is making sure that we are testing homes at the sale or transfer of a lease. So LIRA is lead inspection risk assessments plus abatement of lead hazards in homes. This is a heavy lift. There would be quite a bit of opposition to it. So this is a longer term strategy to move this. There are some pilot projects underway, and we hope to foster a few more to actually do testing of homes and the environment. So that could be the paint on the walls and the dust on the floors, the plumbing infrastructure, and so on and so forth. Another primary prevention policy that we're pushing that actually has legs and is more likely to move in this legislative session in Michigan is the filter first policies for lead in school drinking water and registered licensed daycare centers in the state of Michigan. And the Ecology Center is working with partners in the Michigan Environmental Council, the Sierra Club, Clean Water Action, Natural Resources Defense Council, ACLU, Michigan Nurses Association, the list goes on and on and on. Educators as well, to make sure that we have filtered drinking water stations available at a rate of 1 per 100 students and staff in our schools, in our daycare centers. This is incredibly important, and we'll talk more about this as we go through the program, because when lead sticks around in the pipes and the infrastructure within buildings for long periods of time without moving, the corrosion chemicals that are added to the water to protect folks from lead, coming out of the pipes actually breaks down. And so we're very concerned the fact that many schools aren't, active. Students and staff aren't in them every day. We're not moving water throughout the system because of the COVID-19 crisis and because of school shutdowns. That's an issue. That's even worse than it might be when schools are shut down, usually over a weekend or over a summer break, and things like that. And then secondary prevention policies are also still incredibly important, as I mentioned, making sure that we're testing all 1 and 2 year olds for lead in their bodies, in their blood, and identifying and remediating lead hazards when they're found. When a child is found to have an elevated blood lead level, making sure we have enough money for folks to go in and remove those hazards from the home or the daycare or grandma's house or something like that, wherever a child is being exposed. Mm, There we go. So we talked a lot about PFAS before, and so I'm going to wrap up with a few slides on this. As you can see in this map, and this is from February of this year, and it keeps changing, there are a number of groundwater contamination sites in the state of Michigan. This doesn't include contaminated surface water sites like the Huron River, which is the drinking water source for the city of Ann Arbor, and the contamination that's a problem there. So just to show you again how widespread this is, Michigan is testing for PFAS contamination more so than other states, but there's a lot that needs to be done beyond just identifying the problem and the hazards in terms of what do we do to make communities whole, what do we do to ensure that the polluters are actually paying for the cleanup and not us as taxpayers and ratepayers. So we have done a bit in the last year. In 2000, Michigan adopted new drinking water standards or maximum contaminant levels for 7 different types of PFAS. 2 of those are the strongest in the nation, and the others are not as strong as some of our peers in other states. And we're hoping, we advocated at the time when those were going through the process for them to be stronger. We'll continue pushing the state to have more effective or more health protective drinking water standards. This goes back to the toxic whack-a-mole that we've done. So we have standards for 7 different chemicals. However, we know that there are over 3,000 that are in commercial use. We know that there are many more that are contaminating our drinking water in the state of Michigan already, or fish, or things like that. So this is a problem that we're just starting on. There's a lot of work to be done here. The other thing that happened in 2020 is there was a firefighting foam take-back program to collect and dispose of PFAS-containing firefighting foams. This was really successful. Actually, over 50,000 gallons of foam have been collected now, and we want to continue to make sure this continues on. The funding for this program would have to be re-upped to create it, but there is a policy on the books that would allow us, because the policy passed, would allow us, if there's funding, to jumpstart this program again. So that's incredibly important to get those, make sure that those foams aren't being used by our firefighters, both to protect their health and to protect the health of the communities around them. So one example is the city of Ann Arbor has moved to fluorine-free firefighting foam. And there was recently a tanker fire, well, I guess it was a year ago, over the Huron River, and they were able to use the PFAS-containing firefight, or the PFAS-free, the fluorine-free foam, and didn't actually have to worry about that contaminating the river and then our drinking water here when the fire Fire just went out to put out this fire in 2020 in the Huron River, over the Huron River. So what else must be done with PFAS? We need to focus on prevention and not just treatment. So we want to go make sure that the state goes a step further and follows suit that many other places have done on banning the use of PFAS containing firefighting foam, and also prohibiting the use of PFAS in food contact materials. There are a number of other states that are considering these policies, and we want to keep pushing Michigan in this prevention mindset, because safer alternatives do exist in these areas, in moving us away from the toxic PFAS ones. Make sure that we continue to have adequate funding for testing remediation of PFAS contaminated sites and treatment funds to provide safe drinking water when contamination is found. So that might be providing filters or bottled water in the case where filters have not yet been made available to folks. Ensuring, and this is improving, I will say, ensuring that our public database and maps of all contamination sites are available and accessible and understandable for folks, so that that information exists, but it's not always accessible and understandable. So there's a lot of other work that we think that our department, Eagle, can do to improve that. We talked about biomonitoring and state medical monitoring that is happening in a number of PFAS impacted communities, like in the Belmont area, on the west side of the state in Kent County. But there are a lot of other communities that don't have biomonitoring or medical monitoring related to their PFAS contamination. So continuing to push the state in that right direction. And then really holding the people who are responsible for this accountable. So our Attorney General has filed suit against, I believe it is 14 different companies, including those that make the PFAS chemicals themselves and users of those companies, or those chemicals, like Wolverine. Well, Wolverine wasn't in that suit, that's a different suit. But to make sure that they are actually taking responsibility for the pollution that they caused, they contributed to, so that taxpayers or ratepayers, if you're a water ratepayer, aren't left holding the bill. So I have been talking at you for a very long time now, and thank you for your attention. And we covered a lot of ground. A lot of this is again, the introduction. We'll be going over other things, but I want to see what questions you all have and start up a discussion. So I'm going to stop sharing my screen so I can look at the chat too.
Yeah, and if folks have questions, you can just take yourself off of mute if that's easiest than trying to type it all out. Well, I guess because I do want to be mindful of the time, and I know that we're coming up to the end of our event today, I guess one thing I can do if folks are kind of still disseminating and creating the questions in their mind, I can really quickly go over the next step and some of the quick pieces for that. So Becca, if you could make me host again, I can share my last two slides while folks maybe are formulating a couple of questions. Awesome, thank you. Great, okay. So really quickly, folks probably would have saw the email I sent out the other day that included a link to our website or a little microsite that we'll be using throughout the fellowship program. Orientation materials, like I mentioned, will also live there. So I'll be emailing you all later today and letting you know that that is all up and running. We also have an evaluation link for today that I'm going to chat out really quickly. That'll also be included in the email and then also on the website as well. So it's easy access and everything will be living in the same spot. And Becca did mention that we have another event coming up next week on Thursday from 5 to 6:30. This will be specifically around Lobbying 101. And as she mentioned, this is a joint event that we'll be doing with our Protecting Families from Lead Poisoning program. So we'll be joined by some folks throughout the state to talk a little bit more about how to educate legislators and a little bit specifically around the talking points for the Michigan Alliance for Lead Safe Homes Lead Education Day that they're doing at the end of April. So more reminders about that will be sent out early next week. You all should have received a calendar invite already with the Zoom information, but we'll be sharing that again. And with that, I will stop sharing and see if there's any quick questions before we wrap up today. I'm seeing some head shaking no. Okay, great. Becca, I don't
have any questions.
Anything else you want to?
I was just going to say I appreciated the presentation, and I think I could probably ask very specific questions, but we'll probably get into all of those things later. So I'll save them to when we do that. But I appreciated the presentation, so thanks, Becca, for that.
Great. And email those over. I'm going to put up, well, maybe email them tomorrow to collect them at this point, and we'll make sure that we cover them if they're not already in the agenda for future events. So that'd be great. Excellent. It was really nice to meet all of you, and I appreciate all your time with us.
Yeah, thanks everyone. And I guess with that, we'll wrap up for today, and we'll be in touch and hopefully seeing many of you next week at the next event.
Great. See you next week.